queued in. So I'm going to wait for just a second. Keith, thank you for starting the transcription. And with that, Ethan, I'll turn it over to you. Thank you.
Sounds good. Good afternoon. Thank you for joining us today for another opportunity to discuss filed and preliminary 2025 individual and small group health benefit plan rates. My name is Ethan Baldwin. I'm a policy analyst with the Oregon Division of Financial Regulation, and I will be emceeing today's hearing. On July 1st, 2025, the division held a hearing to discuss the rate review process and heard presentations from insurers explaining their rate requests. At the time of the hearing on July 1st, the division was still waiting on risk adjustment information from the Centers for Medicare and Medicaid Services. After the hearing on July 1st, the division's actuaries continued to review information provided in the initial rate filings. The division also reviewed the risk adjustment data when it was released by the Centers for Medicare and Medicaid Services at the end of July. Today, the division will explain the review that occurred over the past month and share the preliminary rate decisions which were released on July 30th, 2024. Insurers that are present will have an opportunity to respond to the preliminary decision. We'll finish today's meeting with a discussion of next steps. At this time, I'll have division staff introduce themselves, including their role in the rate review process. We'll go ahead and start with Alex Cheng.
Alex is actually not on here, so we're going to skip to me. Hi, everybody. My name is Tasha Sizemore. I am the Life and Health Program Manager for the division, and my primary responsibility is managing the actuarial team that reviews these products. Oh, Alex, did Alex finally get on the call? Alex, are you on?
Good afternoon, everybody. Alex Chang,
yay!
Deputy Administrator for DFR.
Yay, sorry about that, Alex. We didn't see you on the list.
No worries.
Okay. With that, I'll turn it over to Michael.
Hello, my name is Michael Sink, Lead Life and Health Actuary for the division and one of the reviewers of the small group and individual rate filings for 2025.
Hi, my name is Drew Bucks, Life and Health Actuary, and also one of the reviewers for 2025.
This is Ying Liu, and I'm actuary, and also I'm one of the reviewer for the group rates for 2025.
And I'll quickly throw in Tim Hinkle will not be joining us today, but he is the last of the 4 actuaries reviewing these filings.
Hi, everyone.
All right.
I'm Keith Turner. I'm the project manager for the Division of Financial Regulation and support the rate review process.
And Rick Berry, Lead Health Forms Analyst.
And Jason, are you on the call?
Yeah, Jason Horton. I'm a Public Information Officer for the Division of Financial Regulation.
Anybody else from the division that we missed? Okay, back to you, Ethan.
Thank you. The original rate requests were filed with the division in May of this year. Michael Sink will now share the factors that contributed to rate increases.
Thank you, Ethan. Once again, my name is Michael Sink, Life and Health Actuary for the division. I'm going to be going through first the summary of the findings of the actuaries. If Keith, if you could share with the group the published document, we'll get the address for this for anybody who wants to follow along. Just go through page by page what we've got, what we've looked at, and what our eventual decisions are. And later on, we will go through company by company and filing by filing each decision and have the carriers make any comments that they wish to make at that time. So
just
welcome.
A second, Michael. You want to pull up that document on screen? Is that what you're queuing to?
Yes, please.
Oh, no.
All right.
Link it, I think.
And
we
pull
do
it up
the whole
on screen.
document, Michael. Oh, and pull it up on screen. There we go.
Yeah.
There we go. Give me just a moment. I'll pull that up.
Right. there may be people that are following on phone. I was happy to start with welcome. That was a good first slide. There we go. That looks like ours. Okay, so let's start with I'm going to go pretty fast. We've got about an hour and a half, and we have talked through this document in the past, and it can take upwards of 3 hours. I'm not going to do that to everybody today, so I will talk about the highlights. Okay, so first, a introduction to our rate review. I give this summary every year. For those that are new to this, there are 3 main components with which the actuaries do their review of the rate filings each year. We review individual and small group filings for the ACA marketplace that are all effective January 1st, 2025 for this year. And in addition, small group has additional increases for effective dates for April, July, and October of 2025. But we'll get to that in a little bit. We will start with the 3 things that we look at. One is that we look at the starting data, and the starting data for this year is 2023 claims data. 2023 administrative costs. The financial statements come in April. We ask for financial data. We make sure that that information is both credible and appropriate for these filings. And if any extra adjustments have been made, that those are appropriate for the filing. The second thing we look for is the assumptions that go from projecting from the starting period of 2023 to the filing period, which is, of course, 2025. We make sure that those assumptions are reasonable and not excessive, and that they are also non-discriminatory. This year, we found no issues with the assumptions being discriminatory, but all of the findings we have made this year have been based on the assumptions. We will go into detail when those assumptions were the subject of our decision of a rate review action. Final, we look at the calculations that go from 2023 using those assumptions to get to 2025, and we make sure that those calculations are correct and meet the actuarial standards of practice. And that is the basic intro, and so we'll get into this document. We'll skip to the next page here with the requests. Okay, so we have a range of requests for individual of approximately, and I'm going to use a different document that has the averages spelled out for me of just a moment. Minimum and maximum increases in this marketplace is from 5% to 11.6%. You see specific sources on the high end for this year, with the average of 9.3%. Small group has a range of 5.7% to 16.3%, with an average change of 12.3%. These increases are largely a result of increasing in trend. We will talk about trend. We also will be looking at various impacts that have affected the market this year, which includes the basic health plan or the bridge plan. We will take a look at the cost containment efforts and what that would look like. And finally, we will go into the details. Okay, so in this particular case, if we could go down to the next tab, please. These market change, this is a company specific presentation of how they believe that their rate increase is broken down into the various components. So if we were to ask specific source, what leads to their 11.5% increase, they give us 8.9% is experience and trend, a little bit for admin and taxes, slight reductions to benefit plans, and then morbidity increase to 2.5% to get us to that 11.5% totals. This is the company estimate. We take a look at this, but we also go through and we make our own conclusion on what the increase is. Next slide. This is the small group, same. We'll skip this. So the main component, as I said, is trend. Trend consists of unit cost and utilization trends. It's also split between medical, which is your hospital and doctor's costs, versus pharmacy, which is strictly the drug cost component. And those are combined to get to a single trend that is then used to project forward claims experience from the base period to the experience period. Medical trend is up. Unit costs are up. This appears to be a lagging trend. We will look at a couple of charts, but it does appear that medical inflation in markets like this, where the rates are between the providers and the insurers, are lagging behind the overall marketplace, and what we are seeing is the same inflation that other industries were seeing a couple years ago. Pharmacy usually typically trends higher, and that's because the costs for pharmacy, new drugs, new innovations largely come through the pharmacy line, and that's why the pharmacy trends are higher. So if you could scroll down, next tab. We take a look at their historical trends, and as you can see, if you look at the average medical cost, for example, individual was asking 4.6% 2 years ago, 6.1 last year, and this year they are asking for 7.9%. And this, as I said, is the driver of the rate increases for the most part. The trends were supported by the companies. We have not found any, since it is supported, it is not a finding that these trends are excessive. You will see that trends are different between individual and small group, and that's because the market mix, product mix is different, and also that there can be different networks between the two. Next slide. And this is the pricing trend. So that was the historical trend. So that's what they see leading up to their pricing year. And this is what they're actually using for pricing. So they historically they saw 7.9, and they're asking for trends in the 8.4 to 9.4. So it's still increasing. If you look at the chart below, that's where it appears that where other industries were seeing large increase in trend in 22 and 23, they're really catching up here. So we're going to be watching that closely. This is not a finding on their filings, but it is. It has been reviewed, and we do find it reasonable. Next tab. And this is the small group market, same thing. It looks low in years where other industries were seeing high trends. And a lot of those contracts are done in advance, so that could be one explanation on why we see this lagging. Next tab. So while we do recognize that trends are going up, we do have to, the DCBS has a role in Oregon's efforts in achieving a cost growth target. And so the division took these filings, and while the rates are verified, and these are not actual costs, these are projected costs, we recognize that the cost trends that are negotiated between the insurer and provider are in excess of what that target is going to be. Now, that is not up to the rate review to set that, but we did take a look at what rates might look like if we were to reach a goal where the carriers were meeting those cost growth targets. And you can see that rates would be a couple percentage points lower if the carriers were able to meet these targets. They will have to establish during a retrospective review why they were unable to meet those targets at that time. But right now, we're just noting that this is the potential savings that could be made if cost growth targets were met. This does not impact the rate decisions. Next tab. Okay, this is the projected medical loss ratio. There are two MLRs that we talk about. MLR by basic definition is claims over premium. Federal allows the federal MLR, which is part of the ACA, allows for cost containment efforts to be and certain administrative costs to be counted as claims, and to back out things from the premiums as well. The difference in these two factors is there is a federal requirement for the individual and small group plans that they target a 80% federal MLR. As you see, that means 80 cents out of every dollar is going to pay to claims or cost containment or one of these other efforts. As you can see, all carriers and all both small group and individual anticipate paying significantly higher than 80 cents on the dollar for medical claims, which is good. Oregon does break down the administrative costs in detail and look for possible overcharging, make sure that the development of admin is as reasonable as well as the claims. And we feel that that effort is what drives these loss ratios up. And if Oregon did not look at these and carriers simply targeted an 80% federal MLR, rates could be easily 7 or 8% higher than you see here. That's what the federal allows, but Oregon does not. So Oregon, because of our rate review, have suppressed rates approximately 7 or 8 just for this reason alone. That's why we include this as part of our analysis. Next slide, please. We have retention. This is the expenses and various taxes and fees that get added into the to the filing. I'm not going to go through this. There's a lot of information here. You will see expenses is rolled up into a single bucket, but the next tab will show the expenses broken out. But go back to the prior tab, you will see at the bottom of that, it includes the profit and margin. And that profit is expressed as both a PMPM and a percent of premium. Margin is required even for companies that are not for profit for maintaining their levels of surplus so that they can maintain the ability to make payments. We have done significant research in the past on how much this goes into paying executive salaries. We did not do that this year, but we have done it in recent years to show that the amount going to paying executive salaries is not excessive. But this year we are looking at the margins. We also look at how much uncertainty is there in this year, and we'll talk about uncertainty, especially with the bridge plan when we get to that slide. But this lays it all out. Anybody curious about what the other 14 to 15 cents on the dollar goes to? That 14 cents goes to pay for all of these buckets. So, and then that more buckets, as I said, on the next slide. So if we could move on to slide 17. And this is the small group tables identical to the prior. So next, and I think that should be the expense breakdown for small group. And then, okay, need to catch my breath for a second. Next slide. Okay, I mentioned this early on, the Basic Health Program, or OHP Bridge, is the new program launched by OHA with the targeting specifically making an affordable plan for low income enrollees in Medicaid, but it also overlaps with people who are eligible for the individual plan. This is a beneficial plan for those who qualify for it. And so we had to estimate this year how many people would leave the individual market for this bridge plan. And carriers had assumptions that varied widely in their filings, and through questions and discussion, Oregon has decided, and this is our first decision in this presentation, that the reasonable assumption is that half to 2/3 of those eligible for this bridge plan will find it and transfer over to it in 2025. And that's the couple reasons for that. We want to make sure that we transition off or them out of the pricing at a reasonable pace so that we are not, for example, holding rates steady for 2 or 3 years and then ripping off the Band-Aid with a huge hit to the marketplace in 3 years. We want to slowly roll that out, but at the same time, it is reasonable to expect those who qualify to find their way to these plans and enroll. This is in their best interest, so we are encouraging those who would benefit to seek this out and see if this is right for them. So I won't go into the details of the bridge plan here, but I will go see if we scroll down to the next tab. I believe that's where one more. So
Mike,
what
I
does
believe
that?
you're. Oh, go ahead. Mike.
Yes.
I was just going to say that the table you might be looking for is no longer present in this document.
Oh, that would be why I can't find it. All right, so I'll talk about in essence what it does to the individual market instead. So when that many people are leaving, and we expect 19 to 26,000 people will leave the individual marketplace for the bridge plan, these members will all come from the marketplace. The marketplace, these members will have qualified for cost sharing reductions, and those cost sharing reductions were supposed to be originally reimbursed by CMS to the insurers. But instead, when CMS or when the United States government was no longer responsible for reimbursing the carriers, we introduced what we call a silver load on the marketplace to correctly price the marketplace silver plans to account for that reduced cost sharing, or the cost sharing reduction and the reduced payments from CMS. So with that in mind, the side effect was that we raised what is called the second lowest cost silver plan, the one that determines your subsidy eligible or your subsidy amount if you were to purchase for example, a bronze or a gold plan. And several years ago, when we implemented the silver loading, anyone purchasing those gold and bronze plans would have noticed a significant reduction in their subsidy, or the amount they pay after subsidies. And that is what's being reversed as people leave the marketplace. The amount of that subsidy that needs to be recovered reduces, the amount of the silver loading comes down. Therefore, the tax credits come down, and it has a counter effect. So we've counter effect on the rates, meaning that while we are bringing rates down, there are subsidies that are also coming down. So this is just it's two levers on the same pulley. So we decided that the most appropriate thing to do was to take this silver loading and bring it down for approximately half to 2/3 of the enrollment. And there is a table, I don't know if it's in here, that shows what the carriers started at and what they are, what we are, our decision has said that they need to go to. This is the first adjustment. It has an impact on the average rates because you expect, for example, a 12% load on your exchange plans, but you're only getting an 8% load. So for those plans, for those members, your rates would come down 4%. So on average, it appears to be about 1.2 to 1.5%. That is not, when we say we are reducing rates by that amount, we are not talking about the adjustment to the base rate. We are only talking about the adjustment to that silver load. In addition, there is another component to this where, since there is a reduction in the members on exchange, the amount of people that will be charged the exchange fee, and part of it is the federal fee, part of it is the marketplace itself. That fee will come down on average for all enrollees on the plan. So there is a slight base rate adjustment that applies to all members, and that is the sole finding for all individual plans. And the extent that we adjust each of their rates depends on where they started on their silver load, where they started on their admin expenses. Is there any tabs past 20?
Just
All
the
right.
final or the preliminary decisions, I guess. Well, and risk adjustment.
Reinsurance and risk.
I'm sorry,
and
risk
then we
adjustment.
get
Yep.
to-
So readjusted and risk adjustment, we checked those. We didn't find anything this year. I am going over on how long I anticipated speaking on this, so I will just mention in passing. Risk adjustment, we make sure this is supposed to be a net zero sum. Anybody who is charged risk adjustment fees, that money is supposed to go to one of the other carriers who has higher risk members in the marketplace. So that's supposed to be a net zero adjustment. So we check the filings to make sure that they are. Reinsurance, we go through the filings and we make sure that what the carriers project they will receive for reinsurance payments closely matches what we anticipate in our budget. We have we have an assessment out there that collects money from the small group and the large group marketplaces, as well as a few other sources. And that money is used partially to fund this reinsurance program. So we have a dollar amount and we make sure that rates are reduced by an amount similar to that to total. And that's a reinsurance and risk adjustment. We had no findings this year. Now, our rate recommendations here. This
we
is
will get
where
into those. We will get
company
into
by
those
company, but I do want to make one comment. Yeah, I do want to make
Yep.
one comment on column 3. Column 3, that is showing the average adjustment. It is not showing the adjustment for the silver load. And so when we go through and talk company by company, I will also state what the company by company silver load would be reduced to.
Thank you, Michael. Good point.
All right, so
Okay.
that's all I have, and let's keep moving.
Okay, Keith. I think we can go back to the PowerPoint presentation. So I'm going to do a little blurb and then I'm going to hand it back over to Michael. Here's my blurb. In accordance with Oregon Revised Statute 743-019, this meeting provides insurers or any person adversely affected or aggrieved by the preliminary decision an opportunity to meet with the department to discuss and respond to the preliminary decision. During today's meeting, we will discuss the findings and rationale that are the basis for the preliminary decision, which we just have, and Michael will go carrier by carrier shortly. And then we will discuss the actuarial analysis, which we have done, that the division relied on when arriving at the preliminary decision. As a reminder, new facts may not be substituted in today's meeting in accordance with the same rule, or in accordance with the same statute. So Michael Sink will now lead a discussion of the preliminary rate decisions for each insurer. Insurers, as we discuss each filing, we invite you to ask questions or provide comment regarding the filing. And I think just for process sake, I think if insurers with who are in both the individual and small group market, we will discuss both of your rates at the same time. And then Cambia companies, we're going to probably discuss Bridgespan at the same time we do Regions. So just for process sake. So there's that. Okay, Keith, you can advance the slides to the slide that says preliminary decision at kind of the end. And there we go. Okay, Michael, it's on to you.
All right.
Again.
Now, as I said, I will be substituting in the silver load recommendation for column 3, but basically I'm going to go off of this exhibit for individual. We're going to start at the top, which is Bridgespan, and then of course this is also Regions. So for the silver load, Bridgespan and Regions both had a current or had a filing silver load of 12.1%. By our analysis, this was using too few members, assuming too few members for the marketplace to meet within our window, our decision window of 19 to 26,000 members. So our decision silver load is 9.3%. We also recognize that Bridgespan Regions did not get the opportunity to price this themselves. So if we will listen to what their pricing is on these two items, or the same item because it appears to be the same number, and consider that for the final recommendation. There is an additional 0.3% adjustment to the average or to the rates for that admin cost for the marketplace fee. And that is not an adjustment to the admin cost, but an adjustment to the total rate. So the total rate would come down 0.3%, and then the silver load would drop from 12.1% to 9.3%. Starting with Bridgespan, do you have any concerns with the Bridgespan individual filing?
Nope.
Okay. And Regions individual filing, same numbers.
No, we don't have concerns. We did just want to make a statement that we do agree there's a reasonable range of assumptions with respect to migration for the basic health plan. So we do believe that our original filed assumptions are reasonable. We also agree that the assumptions you've asked us to use are also reasonable. We do still have, I believe, an email question out regarding the exchange fee. So that's still somewhat open, whether or not we agree to that number. And I guess in addition, we ask that as the BHP population migrates away from the individual market, We'd like the state agencies to monitor emerging results to identify and mitigate any unintended consequences. Just as there may be material downstream impacts to the ACA individual market that must be thoroughly considered, being driven most meaningfully by a reduction to premium subsidies and could include materially diminished reinsurance funding and a change to the overall risk profile of the market. So as a combination of these factors may lead to otherwise higher rates, further incentivizing more people to leave the individual market.
Noted, and thank you for the comments.
Thanks.
And yes, thank you. I was just going to pop in here and say I am taking notes. So thank you for the comments. And I did kind of jot down what you said, and we are transcribing and we'll be able to come back, but did definitely take notes about your comments. So thank you, Canvia individual. Back to you, Michael.
Yeah, and we will take a look at any comments you had on the admin portion of that. But we'll do that offline. Last is Regents Small Group, which we are recommending approved as filed. Did you have any concerns there?
Nope, we love that. Thank you.
All right.
Before
Moving down
we move on, Michael, hold on. Before
Okay.
we move on, is there anyone from the public or any non-insurer stakeholders who are on the call who would like to comment on Bridgespan individual or Regents individual and small group? The public comment period is technically closed for the initial rate filings, but preliminary decisions do have an opportunity for aggrieved parties to meet with the director, which our insurers are doing that today, so that we can hear from them. But if there are any consumers online, please feel free to reach out to somebody at the department if you have any additional questions. I'll be talking about next steps shortly. Back to you, Michael.
Okay, moving on. Next carrier is Kaiser. Is Kaiser with us?
Yes, Michael, we're here.
Okay, great. Now this is Kaiser did include a silver load adjustment in their filing down to 6.9%. That did match the range that we were attempting to reach with our decision. Something's consistent across the marketplace. So we had no additional findings for Kaiser individual. Recommended approved as filed. Did you have any concerns or comments?
This is David Liebert with Kaiser, and no, we don't have any additional concerns or comments.
All right, great. And small group also approved as filed.
This is Luke Hampton with Kaiser, and we don't have any comments or questions on that either.
All right, thank you. Tasha?
Are there any other stakeholders or consumers who would like to discuss this filing? Hearing none, same offer stands. So back to you, Michael.
All right, great. Next on the list is MODA. MODA, in their filing, they did not reduce the silver load for the basic health plan. That their filing was 12%. We did our calculation and recommend a silver load of 8%. So that would be a reduction of 4% on the silver plans on exchange only, an average impact of 1.5%, and in addition, the admin impact of 0.3%, which would affect all rates. MODA, did you have any comments or concerns you wanted to share with us today?
Alex Vanos of MODA here. No comments or concerns. Agree to reduce the silver loading and reflect the reduced exchange population in terms of calculating the exchange user fee.
Okay, and small group. No findings on the small group filing. Approved as filed.
And yeah, no comments or concerns on the small group filing.
Are there any stakeholders or consumers are there any other stakeholders or consumers on the call who would like to discuss this filing? Hearing none, Michael, back to you.
All right. Pacific Source is next. Pacific Source did include a reduction on their silver load in their filing. Roughly, it was at 14.8% last year. It's down to 8.1% this year. They've already got the impact in their filing. We found nothing else to do with the basic health plan. However, we did find the same issue regarding the administrative costs for the exchange fee, and that impacted their rates 0.5%. So, Pacific Source, do you have any comments or concerns with that finding?
Hi, this is Benjamin Shea with Pacific Source, and we didn't have any comments or concerns.
Okay, great. And small group did not find any issues, approved as filed.
No comments on that one as well. Thank you.
Are there any consumers or other stakeholders on the call who would like to discuss the Pacific Source? Okay. Hearing none, back to you, Michael.
All right. The last of the individual filings would be Providence. So Providence will start at the top. They did not include an adjustment for the silver load in their initial filing. They had a silver load of 14.8%. We are recommending reduce that to 10.3%, consistent with the assumptions that the decision as is putting on the marketplace. And also there is a 0.5% adjustment as well for the administrative cost, and that applies to all rates. Providence, do you have any concerns or comments regarding our decision? I should have checked. Providence, are you there?
I was going to say, hearing none from Providence, I will follow up and ensure that they have time to discuss their decisions with us. Are there any consumers or other stakeholders on the call for Providence's preliminary decision? Okay, Michael, back to you.
All right. We are moving on to the small group only companies. That is HealthNet and United. I will start with HealthNet. HealthNet, you had a single small group filing. We did not have any concerns with your filing. So we're recommending approved as filed. Do you have any comments or concerns?
This is Doug Hill with HealthNet. No comments or concerns.
All right, thank you. Tasha?
Yes, sorry, multitasking here. Are there any consumers or other stakeholders who are on the call who would like to discuss HealthNet's filing? Hearing none, I will turn it back over to Michael for the last two companies, the Uniteds.
All right, United Healthcare. So the one filing that was different than the other filings in the respect that this decision is not reflected or is not a based on the basic health plan at all. However, in the United Healthcare filing, of which I was primary reviewer, I did note that the company was using the same trend. Their development of their administrative costs used the same trends that they were using for their medical costs. And this is one thing that we have been looking for, specifically called out in United Healthcare's fourth quarter filing, which was recently submitted and withdrawn, where the carrier is putting significant increase in administrative costs without a separate analysis of where they expect that to be. And in Oregon, we're really trying to bring that down. We're trying to get carriers to be aware of that, because it is something that we look at on an annual basis. The impact of putting a reasonable trend number in there for the administrative costs, I used a 4.0%, which is even higher than is allowed in the cost growth target analysis, it results in a reduction in rates of 0.5%. United Healthcare, did you have any comments or concerns on that finding?
This is Bill from United Health. We don't have any comment or issues with that. We'll reduce our rates by 0.5%.
All right. And both of those filings use the same assumptions. So it's also true for United Healthcare of Oregon. And I don't suspect you have anything new for United Healthcare of Oregon, but for completeness, any comments or concerns? From United.
No comments, no concerns.
Okay.
Go
All
with
right.
that.
Back to you, Tasha.
Are there any consumers or other stakeholders on the call who would like to discuss United Healthcare Insurance Company or United Healthcare of Oregon's preliminary decision? Hearing none, that concludes this portion of the rate discussion. Before we go on, I'm going to give it one more chance for any comments on any of the preliminary decisions.
I think we can open it up for any questions or comments on the actuarial presentation as well, Tasha. We didn't have one there.
There we go. Any comments on the actuarial presentation of the factors in that were considered as part of the rate filings? All right. Okay. Keith, if you would be so kind to advance to the next slide that discusses next steps. So we are getting toward the end of the rate review process for 2025. The preliminary rate decisions were released on July 30th, and that's what we discussed today. Today we heard from every insurer, representatives from every insurer except Providence to discuss comments or questions that they have about the rate decision for their company. We only heard from one insurer with an extended comment, and it sounds like everybody we heard from today does not have any outstanding issues with the preliminary decisions, and we did not hear from any consumers or other stakeholders. Although, as I said, according to Oregon law, consumers who are and other stakeholders who are aggrieved by the preliminary decision may reach out for a meeting with the division to discuss further. So what happens next? We will go over the information that was obtained today in response to the preliminary orders, as well as some other information that Michael and I can't remember which insurer alluded to today. And with the intent of releasing proposed orders no later than Monday, August 12th. And this is to keep us on a pretty tight timeline with CMS. So proposed orders will come out no later than Monday, August 12th. Rate information is required to be transmitted to CMS for display on healthcare.gov by Wednesday, August 14th. So that's kind of our drop dead date for getting this information to CMS. That being said, we, according to Oregon law, we still have to process the final orders on the rate decisions, kind of finalizing them. It's very much an administrative process, but that's part of the law. So those are expected to be released no sooner than August 23rd. If there are any kind of rate hiccups between the time of transmission and I guess open enrollment, that will be something for Katie and I to figure out, Katie Button at the Marketplace and I to figure out when that time comes. And then finally, the plan and premium information that's transmitted to healthcare.gov will be live for open enrollment, which begins on November 1st, 2024. So those are the next steps that we have here. Ethan, I'm going to turn it back over to you to discuss additional resources.
Thank you. After rates are finalized, consumers can still reach out to the division if questions or concerns about insurance coverage in Oregon arise. Division consumer advocates handle complaints and questions from Oregon consumers who are experiencing difficulties with insurers and insurance products regulated by the division. Advocates use their industry knowledge to analyze and resolve complex issues. And next, I'll turn it over to Michael to discuss the Oregon Health Insurance Marketplace.
Thank you, Ethan.
Michael, I accidentally put you there, so sorry about that. Go ahead.
I caught it. I will read what has been scripted to me. I'm not a script guy, but I will do my best. For the Oregon's Health Insurance Marketplace is Oregon's Affordable Care Act marketplace, where consumers have access to health insurance coverage using tax credits established under the ACA. Oregon's Health Insurance Marketplace also provides technical assistance if your marketplace coverage hits a snag, and is an excellent benefits resource. On to you.
Awesome. Thank you. And as we finalize and wrap up for the day, I would like to extend a heartfelt thank you to our division actuaries, Michael, Ying, Drew, and Tim Hinkle. Tim's not here today. Our MC, Ethan, who has kept up with this, and our temporary MC, Rick Berry, who stepped in for me when I was sick last time. Ethan is also our policy support. I owe a huge debt of gratitude to Keith, who is my project manager for this. Jason for doing all of the comms support, and all of the comms people for standing at the last minute rate tables. Mary Ellen for doing intake, and then the division and agency support, Yasmin, Amy, and Alicia. And then finally, a huge thank you to all of the insurer actuaries and staff at the insurance companies who make Rate Review possible every year. So thank you all. And with that, Keith, I think you can cut the recording, and I think we can call it a wrap for today. Yay.